Hello everybody, and thank you for being here. Your likes, subscribes and shares is what makes this channel work, and I am ever grateful for it. Today I wanted to share with you an inspirational journey of a patient of mine and how we all battled to save his life. This is the story of Sambit Roy. Sambit, a 40-year-old gentleman, found himself battling for his life earlier this year. Now he fell down and fractured his spine, particularly his lumbar spine. To preface all of this, a lumbar spine fracture in itself is nothing too worried about. Many of them get better with medicines. But what made Sambit's case unique was the fact that he was suffering from a condition known as Ankylosing Spondylitis. So what happens in Ankylosing Spondylitis is the spine becomes fused into one block, and then it doesn't get better with rest or medicines. So it is a surgical case. Ankylosing spondylitis fractures can be incredibly painful, and Sambit was struggling with the same. In addition to this, he had severe pneumonia and was admitted to the ICU for several days, where he was receiving very strong antibiotics and on support. During his stay in the ICU, we found out that Sambit was also suffering from cardiac myopathy and his heart function was at 30%. So all of this was very worrisome indeed. But what gave me confidence was Sambit's clarity and determination to get out of this. He was determined to stand on his 2 feet and determined to walk again and to provide for his family again. So here I was, patient admitted under me, a 40-year-old male who can't sit, can't stand, can't walk, can't participate in self-care, in incredible amount of pain, battling with his life, who requires a major spine surgery and whose heart is in no condition to undergo such a long surgery. So it became very evident to me that open spine surgery, or how these spinal fixations are traditionally done, would not be a possibility in Sambit's case. So to help solve this problem, we called in the help of a Bangalore-based Indian spinal navigation system company. And this is how it works. The machine has 2 eyes that, once calibrated, can tell me where I am in position to the spine without actually cutting it up, opening it and taking a look inside. This has several advantages. It means I could then put a screw into the spine without actually making much of a cut. These small holes have very little blood loss and makes this entire surgery then safe for someone with such heart issues. So here you can see I am looking at the left. These are the monitors on my left. The monitor, I'll show you in a minute what the monitor image looks like. But this is the overall setup. You can see the navigation system on my left, the C-arm X-ray system on my right, and on top, the 2 eyes that are looking at my hands. And this is what the image on the monitor would actually look like. So here it's giving projections of how and where we are and where the screws will go into the spine without actually entering the spine. And once all the screws go in, you can see that there is no big cut in the center. There are small stabs, and all these things sticking out are the extenders of the screws. And this is what the surgery finally looked like once we've taken out all the screw tulips and all the screws are in, the rod is in, it's all connected. Here is the final surgical outcome. The spine is entirely fixed through those small ports in the skin. And here is Sambit 1 day after surgery. He's finally able to walk after a few months of being in bed rest. He is in no pain and you can see him smiling ear to ear. And finally, let's listen to what Sambit has to say today. So good evening friends. Today I have with me a very special patient of mine, and we are going to share a little bit about his story. His name is Sambit Roy. He's 45 years old and he has actually been my patient for a long time. And the first time he came to me was a few years back, and through an examination we found out that he has a condition called Ankylosing Spondylitis. So what happens in Ankylosing Spondylitis is the entire spine, which has small flexible units, becomes fused into one big strong piece of bone. At that point of time I told him to be careful, so there was not much to be done, but I told him to be careful to make sure he doesn't fall down, because if a ankylosed bone falls, there are chances of a fracture. I think 5 months back, Shobit had called me up and he told me he's in severe pain. He had fallen down at home and his condition was very bad. So naturally, I thought immediately that maybe he's fallen down and he has fractured his bone. And then subsequently, he's had a very, very bad time. He had to be hospitalized for respiratory issues And those settled down, we re-evaluated him completely, and it turned out he has cardiomyopathy. It is a condition of the heart where the heart function gets lower and the capacity of the heart to deal with stress reduces. So his heart, unfortunately, is functioning at less than 50% of a normal capacity that is expected. So given all of this, we were very worried, and he was in a severe amount of pain. He was asking me to do something to help him. The anesthetist was telling me, listen, this is a high-risk patient. His cardiac function is less than 28%. The cardiologist was telling me, be careful, there may not be, it may be very difficult to get him out of anesthesia. And considering all of this, we had a detailed discussion. Shumayou, do you want to share your experience before the surgery?
Yeah, I have fallen on 1st June 2025. Then I have thought that everything has gone, but then one name came to my mind, that Dr. Shumayou, the angel of the Almighty. I told him that if you can, please do the surgery with a family, is no issue. So sir took the risk and gave me a new life.
After all the risks were discussed, we decided that opening his spine was not an option because he required multiple levels of screws on top and bottom to stabilize the spine. So for him, we did a navigated percutaneous spine fusion from all the way up to all the way down. But all of this was done through through a navigation machine which works like a robotics image acquisition, and entirely percutaneous through small holes in the back. This helped us reduce blood loss and made it very safe for him. In fact, Shumayou, can we see the wound at the back?
Of course, sir.
So, if we look here, this is the navigated port, and these are the small stabs through which all the implants went in. And the night of the surgery, we went and met him in the ICU, and he had a big smile on his face and he was a thumbs up. And he was like, I am absolutely fine, thank you.
Since I am gradually improving, I am almost engrossed in my daily job. Sir, give me the mental power to something. Just have patience, don't do any hectic job, but I am now very, very fine.
The good news is, we did a CT scan just a couple of weeks back, and that fracture has healed completely. So, thank you, Shumayou, so much for sharing your experience.
It's my pleasure, sir. Thank you so much.
The good news is, after seeing the success of this case, our hospital is in the process of acquiring this navigation machine for themselves. So we'll be able to extend and offer this to many more patients who need it. Thank you for the patient listening. If you found this video useful, do subscribe and like. And I look forward to seeing you at the next video. Stay fit, stay active.